pain, you know, or when you talk about it, first don't just jump out and ask them if they have, what's your pain on a scale of 1 to 10? You know, if it's not a chief complaint that would inherently come with pain, if it is dizziness, you can say, are you having any associated pain? No. Good. Moving on. You don't have to get them, well, then what's that pain on a pain scale of 1 to 10? Because they're going to give you this. You talking to me? Okay, I just told you I didn't have pain. So you don't have to do a pain scale on every single patient for every single complaint. Think about what brought them in, okay? But you want to get to character, location, onset. When you use that, it just basically means in your mind that you haven't missed anything, that you're kind of hitting all the big points. So then we're going to go down. Does this work? There we go. You want to talk about pertinent positives and pertinent negatives. Okay, remember those things that are up and down, but always important to the HPI. Then we want to go through and we talk about past medical history to include any childhood illnesses that are the biggies. You know, if they're an older patient, did they have chickenpox as a child? Did they have polio? Is the polio maybe the reason why they're having additional weakness at this point? Or has that weakness that they had been forever since they were 3? Okay, very important to identify that. Talk about past surgical history, so we want to know about prior procedures or hospitalizations. Again, when we talk about that, you know, if you can ballpark a year, that'd be the best. But you certainly don't expect somebody to get everything down. Oh, I had it done at this hospital on this day, and it was this doctor. Just, did you have your gallbladder out? About what time was that? That's good enough, okay? We want to talk about medications. So a list of medications with dose and frequencies, any allergies. Remember, we're always looking for drug allergies, food allergies, environmental allergies, and what their reaction is. And always, if somebody's going to, you know, kind of throw out to you, oh yeah, by the way, I'm anaphylactic to penicillin. If the professor hasn't offered that they're on an EpiPen, you might want to say, do you carry an EpiPen with you? Because that would just go to another level of them understanding that you're actually comprehending what you're supposed to be grasping in a history of present illness. Family history, we would typically want to go back 3 generations. Psychosocial, so again, what's the marital status? Are they sexually active? Again, goal with sexual activity, don't be creepy, okay, right? You just got to know. You can ask preference. If you get in the habit of asking that, make sure that you ask it to everyone all the time. But I will tell you that if you ask your 73-year-old gentleman who is sitting with his wife next to him, is he sexually active, and is he sexually active with men, women, or both, you might get slapped, okay? So all of this, remember, when we're talking about sexual history, it's all to open up a dialogue with your patient, but it's also for risk factor stratification. That's all you're looking for, okay? Again, we want to know tobacco use, alcohol use, employment, education, stressors. You want to know if they've had any exposure, so what is their job involved, have they had military experience, in terms of risk factor stratification long-term for that patient. What's their safety? You always want to ask about a risk for domestic violence. Do you feel safe in your home? That's a simple way to ask. Do you feel safe in your home? Any threats to you? No. Good. Moving on. Okay. When we talk about review of systems, so the review of systems is a laundry list. It is designed to be a laundry list. But remember, these are closed-ended questions. So these are yes and no questions that should go relatively quickly. And if anybody has the Maxwell is basically right where your review of system is pulled from. That little teeny book with the spiral, that's about 10 pages that I carried forever in my first year in work. So you have to ask 50% within each category to get credit for the category, okay? When you get down to, so that goes through basically every system, okay? When you get down to genitalia, if your patient that they gave you doesn't go to the sex or gender of the professor, but it goes to the gender of the patient. So if the patient they gave you is a male and you're sitting with me, you would ask me all the male questions. Conversely, if your patient's a female and you're sitting with Paola, you ask them all the female questions. Okay, you only have to ask those questions that are relevant to that patient's gender. All right, that's why both are essentially considered within one category. And then we go down basically just to endocrine and psych is very, you know, any changes in mood, any depression, any anger, very quick, yes and no's, okay? All of that encompasses 45% of your grade. And again, there's 50 things on there. You have to hit 38 out of the 50 to simply pass this. Yes?
To answer yes or anything, does it go any further, or is it just yes?
Just noted yes, because unless it applies the big things you would have picked up in your history of present illness, because you would have gone for pertinent positives and negatives. And I put that in the instructions to the faculty that if they hit on things in the history of present illness, that they don't have to, you don't have to repeat it in the review of systems. But that would essentially count toward that 50% here. Question?
Yeah.
Oh, yes.
Sorry. For the skin where it says like rashes, lumps, sores, itching, so you're saying you only have to take 50% of what's in that box?
Correct. Correct. So if you're sitting there and you're nervous and you forget all 100% of what's in that box, if there's 6 things and you've hit on 3 of them, you will get credit for that. And yes?
Do you expect us to use medical terminology? Like, I wouldn't expect the patient to know what paroxysmal nocturnal dyspnea is.
No, but you could say, do you get short of breath at night when you're sleeping?
The exam, you want us to use like layman's terms.
Use layman's terms. I expect we have to know how to document it, but use layman's terms when you're talking to the professors. Yeah. Any other questions? Yes.
I have questions, but not for this specific skills exam.
Okay.
For the quiz, is it only going to be available from 9 to 10 on the 29th?
Yes.
Okay.
Yeah.
And we come here to do it, or we do that?
Come here to do it. It's in the computer lab, opens on Blackboard. Yep.
And then for assignment 4, are we allowed to send it to you or meet with you to review it before we turn it in or no?
You can meet with me.
Okay.
Okay. Once you send it to me, it's considered a final submission. But you can come and meet with me. And the goal of 4 really includes review of systems. Okay. So again, when you're looking back to what diagnosis your patient has, what HPI you've built, you're gonna have who has positives on a review of systems. Everybody, right? So if I get a review of systems on your patient and everything is negative, you're probably gonna have points taken off. Okay, so you've got to make sure that it would be relevant to the patient's presentation. Okay, and that, yes, somebody's gonna have a headache every once in a while. It doesn't mean that that's necessarily their chief complaint or what brought them into the office that day. But that should be a good review as to what you have to think about to say when you're doing your skills assessment. Danica?
Question, as far as the blank piece of paper that we can bring in, at what point, I know it sounds silly, can we write on it as far as,
You can write on it right from the beginning.
Okay.
Okay? So you walk in and you've got 20 minutes from the time you start, and the professor's going to tell you your patient, the chief complaint. You can sit there and write a cheat sheet, character, location, onset, duration, so that you hit every point. If you wanted to write out your review of systems, even if you only wrote the 14 categories to make sure that you hit every category, that's fine.
Okay.
Because that's how you're going to start to learn how you're going to take a history and physical long term. So writing your own little cheat sheet and kind of getting in your own habits, that's fine. Okay?
Cool.
Yes, Jeff?
We don't have to do a write-up after this.
You do not have to do a write-up after this. That's essentially what you get on that grade is final. You don't have to write up any of that information, because basically assignment 4 is like a write-up, and essentially the semester ends almost at next week, I think. So that
Can we
would be a
bring
little
this?
too much to grade. You cannot bring that. You cannot bring your Maxwell.
Just asking.
Nicely done, though. 1 piece of paper, 1 writing utensil. That's it. Okay. And again, always with regards to oral simulations, the don't ask, don't tell. So there'll be multiple scenarios, but you should put your classmates through the same torture that you went through. Yes, Sam.
I have a quick question. When you said about we're here for the initial consultation, that's the establishing the agenda, right?
Correct. Like if you want to put your patient that they presented, for example, worst headache of their life, hey, we're in the ER, bless you, but still, even despite being in the emergency department, you still have to do a comprehensive, you still have to hit on everything. That may not be real life, but you need it for this assignment. Okay? Any other questions? You guys have a tested sense, don't you?
Yeah.
No? A quiz. Okay. George?
So the best way to go about some of this, just to be, a presentation, let's have to ask you a bunch of questions. They're all yes or no. Some of them may be repetitive, because if I'm asking them, do they have a cough? And then I have to go and, well, is this productive? What color is it? And they did have a cough. You know what I mean?
Right. Right, so if the answer to the cough is no, then the other stuff, you don't ask about a cough production, but you ask about the other things. Have you been short of breath, any shortness of breath with sleeping at night?
Okay.
If the answer to cough is negative, then you have to know in your mind, you would skip sputum production and all that kind of stuff. Yeah. Any other questions? Okay, yes.
Breast ROS for a guy, still same.
Men get breast cancer. Yep. Same questions. Any masses, lesions, discharge from the breast. Yep. And then conversely, a man can have a pituitary tumor and have essentially milk coming from his breast, like he's lactating. Gynecomastia, that kind of stuff. So always breast exam on it, or breast review of systems on every single patient. Yes.
So you listed dyspnea under respiratory and cardiovascular.
Okay.
It says dyspnea, we put bronchial, count that for both. Any shortness of breath.
Any shortness of breath,
Yeah, you would just.
it would count it for both. Mhm. My thought process is you're going to get in there and you're going to forget a good 20 to 30% of what you're supposed to say anyways, just because everybody gets nervous. That's normal, So if you think in your mind you've said it before, just kind of hit the other key points. Remembering too, like polyuria falls into 2 categories, so don't say it twice. If you've asked it once in endocrine, don't ask it again in GU, so that kind of stuff that's repetitive, your professors will know. And I've given them fun instructions to go by. But this will be done in their office. I did not say that. This will be done in their office, so at their slotted time. So those 2 days, basically, the main door will be open. So you'll wait in the vestibule area, and when you see the person's name in front of you that's heading out, if I saw Kirkpatrick heading out and I'm the next name on the list, I'd be walking back to that office. Okay? There'll be, just because of faculty availability, and we're testing the AD students those same days as well. So it'll be kind of the same people who are doing it on Wednesday afternoon may not be doing it on, professor-wise, may not be doing it on Thursday morning. Okay? Good? Yeah. Okay. All right, guys, have a good day.